Assalamu alaikum. This is Dr. Ania Humayun from Community Medicine Department of Rashid Latif Medical College. Today our MCQs topic is primordial prevention and its application to preventing cardiovascular disease for first year MBBS students. Question number 1 is, a 25-year-old man from an urban area frequently eats fast food and leads a sedentary lifestyle. He has no current hypertension, diabetes or dyslipidemia. Which of the following interventions best represents primordial prevention of cardiovascular disease in this case? A. Regular screening for blood pressure and lipid profile. B. Counseling to adopt a healthy diet and regular physical activity. C. Initiating low-dose aspirin therapy. D. Early detection of left ventricular hypertrophy. E. Treatment of prehypertension with ACE inhibitors. The correct answer is option B. Counseling to adopt a healthy diet and regular physical activity. Next question is, a government health department launches a campaign promoting bicycle use and discouraging junk food advertising. Which level of prevention does this strategy represent in the context of cardiovascular disease control? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Primordial prevention. And E. Rehabilitation. The correct answer is D. Primordial prevention. Next question is, in a community where childhood obesity rates are rising, a policy banning sugary drinks in school cafeterias is introduced. This measure primarily aims to A. Prevent complications of obesity. B. Detect obesity in early stages. C. Eliminate risk factors before they emerge. D. Promote weight loss among obese children. E. Screen for prediabetes. The correct answer is option C. Eliminate risk factors before they emerge. Next question is, a 30-year-old woman with no cardiovascular risk factor attend a health education session on maintaining a balanced diet and avoiding tobacco. Which statement correctly identifies this activity? A. It is a secondary prevention targeting early disease. B. It is tertiary prevention to prevent recurrence. C. It is primordial prevention to stop risk factor development. D. It is screening to identify at-risk individuals. E. It is primary prevention through medical management. The correct answer is option C. It is primordial prevention to stop risk factor development. Next question is, which one of the following best differentiates primordial prevention from primary prevention in cardiovascular disease control? Option A. Primordial prevention targets early disease while primary prevention targets complications. Option B. Primordial prevention prevents emergence of risk factors. Primary prevention acts after risk factors appear. Option C. Primordial prevention involves treatment. Primary prevention focuses on policy change. Option D. Primordial prevention includes rehabilitation, whereas primary prevention includes screening. Option E. Primordial prevention is community-based, whereas primary prevention is hospital-based. The correct answer is option B. Primordial prevention prevents emergence of the risk factors, whereas primary prevention acts after risk factors appear. Next question is, a school health program incorporates daily physical education, healthy lunch menus, and no smoking policies for the staff. The cardiovascular benefit of such program represents A. Tertiary prevention by minimizing the complications. B. Primary prevention by controlling hypertension. C. Primordial prevention by reducing exposure to risk factors from childhood. D. Secondary prevention by detecting prehypertension early. E. Quaternary prevention by preventing over-medicalization. The correct answer is option C. Primordial prevention by reducing exposure to risk factors from childhood. Next question is, a 35-year-old corporate employee joins a wellness program designed to manage work stress and promote healthy eating before any risk factors have developed. The program's impact on cardiovascular disease risk reflects A. Secondary prevention. B. Primary prevention. C. Tertiary prevention. D. Primordial prevention. And E. Screening. The correct answer is option D. Primordial prevention. Next question is, in an underprivileged area, the government improves access to healthy food options and creates parks for physical activity. These initiatives are examples of A. Individual level secondary prevention, B. Population level primordial prevention, C. Primary prevention by vaccination, D. Tertiary prevention by lifestyle modification, E. Behavioral modification after disease onset. The correct answer is option B. Population level primordial prevention. Next question is, a medical student is asked to identify the most appropriate example of primordial prevention from the following options. Which should she choose? A. Cholesterol screening for adults above 40. B. Smoking cessation counseling for current smokers. C. Developing school-based programs promoting lifelong healthy habits. D. Treating prediabetes with metformin. E. Rehabilitating myocardial infarction patients. The correct answer is option C. Developing school-based programs promoting lifelong healthy habits. Last question is, a healthy policymaker proposes taxation on sugary beverages and trans fat-rich foods. This measure primarily contributes to cardiovascular disease prevention by A. Detecting risk factors early, B. Delaying disease progression, C. Preventing the establishment of unhealthy behaviors, D. Reducing mortality among diagnosed patients, E. Promoting tertiary care facilities. The correct answer is option C. Preventing the establishment of unhealthy behaviors. Thank you so much.